September is Prostate Cancer Awareness Month, and today we're joined by Dr. Benjamin Lowentritt and prostate cancer survivor Bob Lane to talk about why this is so important for us in terms of prevention. Thank you both for taking your time with us here this morning. First question I have for you is, when should people start getting screened for prostate cancer, and then also how often?
Well, thank you very much, and I'm really pleased to be partnered with Johnson & Johnson to share information during Prostate Cancer Awareness Month. We do generally recommend that people get screened at some point in their 40s. I think it's really important to have a baseline level. And then typically at about age 50, depending on your family history, getting screened yearly into your 70s for men.
Now, Bob, let me ask you a question. I'm hearing that you've had quite the journey, even for yourself. Can you talk us through when you first learned, and then the process that you had of being treated, and what you want other people to know through your own experiences?
Yes, sure. Thank you very much. It's been a journey. I'm in my 12th year. First got diagnosed in 2014. It was removed surgically. It came back in 2017. And we watched it grow for 4 years till 21, when they located it in my C1 vertebra, which is a weird place to end up, but it happens. And they blasted it with radiation, and I've been cancer-free since, because I've been on a combination of drugs, including the Erleada drug, which actually it inhibits the cancer cells from marrying to the testosterone cells. So it's basically a state-of-the-art program.
Bob, I heard you mention, you said it's a weird place for it to end up, but it happens. And I imagine there are some misconceptions or things about prostate cancer that people don't really know. So, Doc, I'll ask you about that. What are some of the types of prostate cancer that are lesser known to folks? And also, do hormones play a role in it?
Yeah, and I think Bob started to sort of share with his story. Prostate cancer, there's a lot of discussion about screening and about the early stages of the disease, but when it becomes metastatic, when it spreads and we don't find it or not able to treat it early enough, then it really is this question of, is it still responding to hormonal therapies or not? Because testosterone is really the fuel that feeds the prostate cancer. And we do now have a lot of information about a number of medications, including Erleada that Bob mentioned, which helps block testosterone's effect so it can't feed the cancer, and it can restrict that ability of the cancer to grow for years in many cases.
Now, Bob, you got a pretty interesting nickname, Elevator Bob. What's that about, and how does it fall in line with your now advocacy work?
It's a nice moniker to have, and I'm proud of it. The head nurse asked me one day if I would be happy to speak with other prostate cancer patients as they attend and come out of the advanced prostate cancer clinic twice a week. And I said yes. So I share information. I let them know they're not alone. That's the key thing. Give them hope, give them support, share credible information. I sit out by the elevators, in the elevator lobby, and they refer to me back there in the offices and say, hey, you saw that guy sitting out there? He's a friend of ours. He's a patient. He's in his 12th year. He has a story to share and information to share. So I speak to patients, probably significant conversations, maybe 6 different patients a week, and share that kind of information with them.
Well, I told you both before we started that my family has been directly impacted by prostate cancer. So thank you for the work that both of you are doing to make sure other people are aware and that they can stay protected and stay healthy.